Good morning, Mr. Secretary. How are you?
Mr. Chair, I'm doing well. How are you today?
All right. All right. Good morning, everyone. I'd like to call the meeting to order. Today is February 16th, 2024 for the Eastern Shore Delegation meeting. Can we please rise for the saying of the pledge? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Morning, Delegate Otto. Could you offer prayer today for us?
Yes, Mr. Chairman, let's seek a posture of prayer. Dear Heavenly Father, we come together this morning to do the will of your people, do your will, that we seek their needs and we seek the opportunities to improve our lives on the Eastern Shore and the state of Maryland. Please give us wisdom and discernment as we get through the middle part of this legislative session, and give us the patience and kindness to realize the needs and ways to fix the circumstances. May we keep our citizens safe and secure and comfortable to go to school, to learn, and to improve their lives. We ask these things in your name. Amen.
Amen. Members, can I get a motion and a second to approve our meeting minutes from last week?
So moved.
Second.
All right, great. So, good morning, Secretary Day. You're off at the start, and the floor is yours. Good morning.
Good morning again to the entire Eastern Shore delegation. Thank you, Mr. Chair. It's a pleasure to be with you today. Be back with you. It's been a little while, but really glad that I have the opportunity to share with you just some thoughts on the housing bills that are before each of your chambers. As you know, the governor has talked about, and I think it's been widely reported that Maryland is facing a housing shortage. This is not unlike every other state, and almost every state so far has taken an approach, one way or another, to trying to remedy that situation. Some of those efforts have been really comprehensive. In other states, there's been very sort of incremental steps taken. I like to think Maryland has a Maryland-based solution, and that the governor's plans, as well as not only those three housing bills, but also the complementary budget increases to housing, reflect a very moderate approach to a crisis that again requires our investment. I want to also state from the get-go that the comptroller did a great job yesterday speaking to these issues before the Senate and before Senator Carozza. I don't know if she's on the call, but these issues of a housing shortage extend way beyond just the safety and comfort and dignity of families. It's really an existential question for the state of Maryland. And our economy has stagnated for years, and we are constrained. And the comptroller's report, as well as recent polling, suggests that not only do Maryland citizens and those who wish to be Maryland citizens feel that pinch, it's affecting their household budgets, it's affecting our economy writ large, and we have to respond. So that response, the way it looks, and I'll be brief, I promise, particularly so there's time for questions, so long as that's okay with you, Mr. Chair. The response is a three-pronged approach, acknowledging first that there are really two categories or buckets within which you can place the barriers to building, to producing housing. We didn't get here overnight. This has been an issue since 2008. We have, as a nation, stopped building housing in any quantity that reflects population growth or any quantity that reflects replacing housing stock. Now, prior to 2008, we've got a varied history, and certainly heading into 2008, we had a real estate-driven financial crisis So we can understand why the market reacted the way it did. But getting out of that requires acknowledging that there are both financial barriers and there are regulatory barriers to development into housing production. And so the governor's Housing Expansion and Affordability Act seeks to address those regulatory barriers by doing a number of things. Number one, in 3 targeted areas around transit stations, around nonprofit-owned land. So that's churches, colleges, hospitals, et cetera, and around former state-owned campuses, even places like Crisfield Armory. There are density bonuses that would be provided to incentivize developers to act. The truth is the government doesn't build much housing. There are very few examples of that. Montgomery County is a well-known example that's gotten some recent attention, but it's a private endeavor. And so getting the market to respond is really our charge. The second component of that bill is oriented on manufactured housing. We spent 6 months this summer and fall working with MACO and MML to design these bills and work with them on the proposed solutions. And a big thing that their members identified was that manufactured housing was banned in many jurisdictions. And really the reason behind that is jurisdictions not wanting to allow mobile homes. Manufactured housing by code and this allowance would not allow mobile homes in single-family neighborhoods. It would simply allow prefabricated homes affixed to foundations in line with the code, building codes, including sprinklers and all of those modifications to building codes that have been done in recent years to be allowed in single-family zones. And the final piece is that it restricts jurisdictions from using adequate public facilities ordinances to unreasonably deny permits that would affect the viability, density, or affordability of state finance housing projects. I mentioned that we don't build much housing, but we do subsidize the development of affordable housing, long-term affordable housing that will be guaranteed to match working incomes for 40 years. And this would prevent those tools from being misused beyond their original intent. The second bill is the Housing and Community Development Financing Act, which has 2 components. The first is that it would create a CDE, or a community development entity, which is the U.S. Treasury designated vehicle through which new market tax credits flow. Those are nationally competitive. Just to clarify, those are not competed within the state. So it's not as if one of the 4 or 5 existing CDEs would compete against this new entity. We compete nationally, and Maryland underperforms. We bring too few of those new market tax credit investors into this state, but it'll help with catalytic development of all kinds of things. The Target and Home Depot on the north end of Salisbury was a new market tax credit deal. You can do new market tax credits for home ownership, commercial development, community institutions, you name it. And again, we are punching way below our weight class and ought to do better bringing those federal dollars here. The average award is $50 million for federal investment in those projects. That's the average. And the second piece of that bill is that the Strategic Demolition Fund and its Baltimore City counterpart, Project Core, 2 state grant programs for pre-development. So that's site acquisition, demolition, stabilization, and architecture and engineering would be able to be used. Those state allocations would be able to use for debt service and credit enhancement, meaning we could issue debt through CDA, our lending institution within DHCD, essentially, and repay it. The reason why that matters is demand for strategic demolition dollars from your communities and other communities around the state is incredibly high. We don't have the allocations to match those. And so at a time when we're trying to spur economic development, looking at a portion of those funds being available for debt service, issuing debt, having more capital available for those grants on the upfront, being able to issue larger awards and more awards would be a reasonable thing for us to pursue if our objective, again, is to kickstart the economy. In Baltimore City, the reason that has relevance is they've got an overwhelming vacancy problem, and the slow trickle of resources is not going to get the job. The final bill is the Renters' Rights and Stabilization Act, which simply acknowledges that it's going to take time to build our way out of the housing crisis. Supply is the answer. It's a market issue, but it's going to take time. And so in the meantime, there are renters in particular who are vulnerable, who have been affected significantly by rising rents and rising prices. It most dramatically is affecting the lower income spectrum in this state. And so we're doing our best to respond to that by creating some changes in policy. One that would be similar to what Salisbury has. So we have a tenant's bill of rights. That's an addendum to every lease. A couple other jurisdictions have it too. Doesn't create new rights, but it would be a bill of rights just to make sure renters have full awareness of their rights and resources. It also creates a small Office of Tenants' Rights within DHCD. The truth is we're a financial institution, and most of what we do, not all, but most of what we do looks for the best interest of the financial viability of the project. And I would tell you, about 100 emails and voicemails I get a day are from people who are renting saying, what are you doing for me? Why aren't you helping me? And we don't have a very good answer for that unless the state has invested money into the project, which is a small subset of housing. So it gives us a way to be a broker of housing counseling information. It also it increases with the intent to reduce it increases the eviction filing fee with the intent to reduce the number of evictions and eviction filings that happen in the state, with the lowest filing fee in the nation and the highest rate of eviction and eviction filings in the nation. So we're trying to address that. It would also ban evictions in certain states of emergency, and it would also provide for additional protections for renters by capping the amount of a security deposit at 1 month, which is something that our neighbors do in other states and 12 states in DC do. Lots of other details in there, but I'll spare you all of those, and happy to pause for questions if there's time. Delegate Adams.
Okay, thank you, Secretary. And as I look for some hands, I do have a question. As you know, I'm a small business market participant, landlord, and could you, there was this world that it feels like it was before COVID, and then now, as we're literally still working our way through some of the effects of COVID, and one of those had to do with how our state was helping people during very difficult times when businesses were having to shutter, and people's willingness or ability to work in those scenarios led to a place where tenant supports were being put in place. And my only question, not to get into the politics of 693, but rather just to try to get a thought from you as to where you see tenant rights within the lens of, we went through this once in a generation difficulty, and perhaps I have just a worry that some of the things that we're codifying or trying to make permanent are a portion of things that we were doing as a state out of the emergency of that, and just wanted to talk about that. Obviously, these bills had hearings this week, and the committees of jurisdiction are going to work through the bill, so I don't want to talk about the bill necessarily, but just your thoughts on where we are today versus where we are in like 2020 when things were really bad.
Yeah, happy to. So just from a sort of the philosophy of this standpoint, I'll keep it high level there. I think there's two ways to help people that are going through financial strain to stay in their housing. One is tons of cash, and the other is creating a system that's fair and balanced. And I think we have examples of that around the nation. That's what we're proposing. Not just because of today's fiscal situation, but because I think the best use of a taxpayer's dollar isn't to provide all of the emergency rental assistance that we provided during the COVID crisis. It's an expensive endeavor. It's too expensive to sustain. It's not fiscally responsible. It doesn't mean I don't think that it works. It does work. It's a tool, but you have irresponsible choice if we pretended as if we could go on forever funding things the way we did during the pandemic.
Thank you very much. Delegate Hartman.
Thank you, Mr. Chair, and thank you, Secretary Dave, for being here with us today. So, this past week, one of the bills we talked about was the the priority funding for just communities. And you had talked about strategic demolition and things like that. And that's the kind of money that's going to be allocated based on just communities. Really raised concern for me, as to the allocation of making sure that the rural counties will see some of that money. And I tried to get an amendment on the bill, whereas based on the population of the rural counties, that at least if, say, hypothetically, 30% of the rural counties or the rural counties made up 30% of our population, at least 30% of that money would go to those rural communities. And even
investigate what kind of went down with all of that. I mean,
somebody needs to mute.
Last night, but that's fine.
Thank you. So, concerned with the allocation of money, because that strategic demolition money is useful in all parts of the state. And then, just going along with the theory, no one left behind, just trying to make sure that the rural communities aren't left behind. Can you elaborate on that?
Yes, sir.
There was, let me say one thing further. There was like no matrix or rubric as to how you're going to score or quantify those. So it's very discretionary, and that's what added cause and for concern.
Yes, sir. So you're right that we did not propose any sort of matrix yet for that. Really, we're asking for the authority to develop that in this coming year with the Just Communities bill. This is also a relevant conversation to one of the governor's priority bills, the Housing and Community Development Financing Act, because again, that expands the number of strategic demolition dollars that would be available. So I think it's a relevant question for both of those pieces of legislation. As I testified before your committee, the Just Communities mapping legislation it's codifying a level of work that we already do today. We do sort of critical analysis and review because we receive $6 in requests for project funding for every dollar that we have allocated, and demand is so high. One of the things that I would point us to on Housing Community Development Financing Act and the Just Communities Act is looking at the Sustainable Communities Map. So under state law, all of the state revitalization program dollars are only eligible to be spent within sustainable communities. In Wycomico County, that means Sharptown and Mardella and Hebron and Fruitland and Salisbury, kind of the core part of Salisbury, Willards and Pittsville. In Worcester County, it's Berlin and Ocean City, and Snow Hill and Pocomoke. And when I say Ocean City, the southern 20 streets, kind of the downtown area. And then in Somerset County, it's Crisfield and Princess Anne. And I could go up the shore, but it generally follows a portion of municipal boundaries. And for the smaller municipalities, it's usually the whole municipality. So the municipality gets to submit a plan that includes a proposed map for their sustainable communities. All of those areas would be eligible for any of our funds, but the Just Communities, you're right, is an attempt at prioritizing based on the damage done by past government action. In Salisbury, the way that looks is, you've got areas like Route 13 and Route 50 that carved through the city. You got urban renewal dollars that went into the west side of town and tore down blocks of Black-owned businesses. And so trying to reinvest in a way that's not building upon the damage, but acknowledging that we can do better is our intent. And certainly, I think a conversation about what portion of state funds go to do this work, what's eligible, what's not, whether or not we have some sort of guarantee that it reaches every county or certain counties, I think are all reasonable conversations to have.
Well, thanks for the response. And, I don't know if you know this, my life outside of here is investment properties and so forth. And you talk about all these things that you think will help and make renters and so forth have more affordable housing. But, when you're doing things like limiting security deposits and so forth, I've never had a situation where, you're putting somebody out and 1 month is going to cover it. I mean, you're talking about damages, you're talking about rent and everything else. So the more hurdles you make, then taking away property owners' rights with, first right of refusal to tenants and things like that. If you want to transfer the family, say the property to a family member or something, you really, that would prohibit that. And I think a lot of the good intent, you need to understand that there are other options out there for landlords. I mean, Ocean City right now is being faced with huge tax increases, double the insurance. If anybody's in a condo situation, the bill that created the reserve study and so forth, it's just a tsunami of things coming at property owners. And there are other options, so if you live with Maryland being a real estate investor, I don't have to stick to residential property, so I'm just concerned that there needs to be balance, to make it work for the tenants. It also has to work for the landlord as well. And we need people who are wanting and willing to be in this business. If it was easy, everybody would be there. And as you know, it's not easy. So I just ask that you keep that in mind when you're, discussing these kind of policies. I really would appreciate it.
Well, I just want to say real quick, I completely agree that balance is important, and that I think looking at the landscape nationally, Maryland is a little out of balance in how we handle evictions, and that's just a subset of what we're talking about. I understand, because I also understand that landlords put a ton of effort into their properties, a ton of resources into their properties, and take on a ton of risk. And we want to acknowledge that too. Our financing work and our effort to reduce regulatory red tape, all of that is in the hopes of creating more landlords and getting more people into the business. So it is a balancing act. You're 100% right. I'll also note just really quickly that the right of first refusal legislation does exempt family transfers. So it does enable estate transfers within family without having to give tenants an option to purchase. And it's also, I do think it's worth noting that working with MACO and working with MMHA, we brought that down to just properties with 1 to 4 units. So really the smaller properties, and not big multifamily negotiations.
And during COVID, and I understand that was an extreme situation, there was all these things to help the tenant. But as a landlord, there was nothing offered to us. Owning rental property doesn't mean you have employees. So all the programs were geared at business with employees and so forth. There's landlords that are on the hook for millions of dollars, and then tenants are encouraged not to pay, and there's nothing there propping them up. So just keep it in mind. I appreciate the work you're doing.
Thank you, Delegate.
Thanks a lot.
Yes, sir.
I think I see Senator Carrozza's hand up. If it's not Senator Carrozza, maybe it's just a mistake. I'll just give a second and see if it's not her.
Yes, thank you, Mr. Chairman. This is Pat with Senator Carrozza's office. She's in EEE meeting this morning. Good morning, Secretary Day. I just have a point of clarification. When you talked earlier about pre-manufactured housing not being mobile homes, where do you stand with respect to the so-called tiny houses? Because we're seeing more requests for possible developments in houses that don't have wheels on them and that are, say, 600 to 900 square feet.
Pat, thank you so much for that question. While I'll try not to venture too much into the ADU debate, only because the General Assembly made clear your intent on that, which was you wanted a task force to study it and to report back. So I know that work is ongoing. But what I will say with respect to size, I mean, I think we're in the kind of shortage where we could use everything. And so if there's a market for it, I fully support it. I once lived in a 440 square foot apartment. I don't know that I'd want to again, but somebody out there does. And I think we can certainly acknowledge that, again, if there's a market for it, we should make it possible. What I would say is in West Ocean City recently, I toured 2 different developments of tiny homes. One is treated as and help me out here, representatives of the West Ocean City area, if I get this wrong. I think the zoning was essentially a horizontal hotel. I think I'm saying that right. That's how it was described to me, which I'm not familiar with in other jurisdictions, but basically tiny homes on one parcel. I think the primary purpose of those was second home, rentals. And then I toured another development of primary home, tiny homes, in the, maybe 800 to 1,000 square foot range. I think still multiple units on the same parcel, which to me is, that's not an issue I think I have a strong opinion on. But I do think that the product was really nice. They were manufactured in Delaware. I wish we were manufacturing them in Maryland, but the product was nice. So I'd support ways to enable that to happen more frequently if the marketplace exists.
Thank you. I saw that proposed development as well in that parcel. I think it's being sought after more for workforce housing to fill that need. But essentially what you're saying is from the state perspective, not a problem, but we need to go back to the county with the EDU situation.
I think, again, county zoning laws are going to primarily dictate, county and municipal zoning laws are going to dictate what's possible today. And that's the purpose of that ADU task force, to try to sort out whether or not there's any sort of statewide policy needed. And I just don't know their work well enough to comment on it. But I think what we can do to enable builders, developers to respond to market demand is smart. Again, we got a severe housing shortage, and I know Ocean City is no exception.
Okay, thank you for that.
All right, Secretary, I'm just at the risk of time because we're a little bit over time. I've got one last question, which is, DHCD is a tool in the toolbox for community development and housing. Counts on federal and state dollars to make it work. And I just thought I'd ask you, do you feel like over the next 3 to 5 years that your funding projections are going to match the goals of your department? Before you answer that, we're not statistically driven here on the Eastern Shore delegation, but I want you to know that we have over 100 participants on this Zoom call, plus who's ever on YouTube. So I'll just let you judge for yourself while we have so many people here. It's double what we normally have. And go ahead and answer, and we'll close after that.
Mr. Chair, is that a warning not to say anything that would contradict the governor's budget?
No, but I'll tell you, I've asked a lot of, this is a question I've asked many of the department secretaries, and in many cases, I think we do worry, especially on the Eastern Shore when there's priorities with healthcare and funding, that the departments feel good about it. It helps us understand and better appreciate what things you're thinking about and how you go about it. So if it's a question that you'd it's to be continued, I can certainly, and that's been an answer in the past.
No, I'm happy to weigh in because I think this is an important topic. And I've learned a lot about this agency in the year that I've been here, things that I didn't know before I got the job. I always knew the DHCD was a source for funding projects in our communities. It was an economic development tool. And what I've learned, which I didn't know though, was that it's also operationally self-sufficient. Our state operating allocation is a tiny fraction of our operating costs, and almost all of those operating costs are paid for by revenue that we generate. So we're a bank, we're a lending institution, we're a business. We do business lending, we do housing development financing, we do lending, mortgage lending. We're in a number of different businesses, and the proceeds of those pay for our department's operations almost entirely. So I think from an operating standpoint, while we have needs, I think we are in a good place. In order to achieve the really big objectives that we have identified as a state, I think that our CIP, as proposed in the governor's budget, comes much closer to where we need to be long term. We just got to sustain that work. And what I would just point you to, and I'm sure other secretaries would tell you something similar, but what I would point you to is there's a press release that just went out a minute ago, $17 billion in economic impact last year from DHCD's $2.5 billion in lending and grant programs. We have we produce pretty big bang for our buck. We don't have a vision for communities. Our job is to support the vision of your communities. And I can't think of a better way to incentivize action than through our programs out in the hardest hit parts of our economy and our community. So, so I would say we're getting there, and I fully support the governor's budget, and we'll continue to ask for the resources that I think are good uses of taxpayers' dollars next year and beyond, and as long as I'm trusted to be.
Very good. Thank you for the answer. Okay, seeing no further questions, Secretary Day, thank you for being with us today.
Great to be with you. Take care.
All right, next up, we have our Eastern Shore Destination Marketing Organization representatives. The floor is yours.
Thank you, Mr. Chairman. We have a presentation that's here. Here we go. All right. Good morning, Mr. Chairman and members of the Eastern Shore delegation. And thank you for allowing us time on your agenda this morning. We've come to bring a little sunshine on this cloudy day and talk about the good news of tourism. I'm Cassandra Van Hooser. I'm the Director of Economic Development and Tourism in Talbot County, and I'm here this morning with representatives from all 10 of the Eastern Shore's official destination marketing organizations, and that's better known as DMOs. And we're here to say thank you for your continued support for the tourism industry. We truly feel as if we're among friends here, Mr. Chairman, because all of you know firsthand that tourism is vital to Maryland's economy as it delivers opportunity and quality of life for Marylanders. Every dollar spent to market the state of Maryland as a tourism destination returns $31. That's a terrific return on investment. More important, dollars are brought into Maryland from other states, benefiting our local businesses and generating revenue. Because of your support, we've been able to increase state and local tax revenue, create jobs, and generate a positive economic impact. At the state level, you can see the numbers here. Maryland saw 43.5 million visitors in 2022. Those are the most recent numbers. We have a new study coming out soon. These visitors help support 187,296 total jobs. Now, if these workers stood shoulder to shoulder on the Ocean City Boardwalk, they would span the boardwalk 14 times. But let me help you with the math. That's 42 miles. While here, visitors spent $19.4 billion. This influx of revenue reduces taxes for each Maryland household by roughly $1,000 and funds vital citizen services, including transportation, education, public safety, and as you just heard from Secretary Day, housing. When people hear tourism, many think of hotels, but the benefits of the tourism industry extend into many different sectors, including food and beverage, retail, recreation, air and local transportation, as well as lodging. What do these numbers translate to here on the Eastern Shore? Let's paint the picture. It translates to jobs, revenue, quality of life for our Eastern Shore residents. And now I'm going to introduce you to my DMO partners on the Eastern Shore to talk briefly about their individual jurisdictions. I'll start by introducing my colleague from Caroline County, Tara Hill-Coursey.
Thank you, Cassandra. Good morning. I'm Tara Coursey. I'm the tourism manager and designated DMO for Caroline County. Thank you so much for your time today. Caroline County prides itself in inviting visitors to explore our rural landscapes, take part in our various outdoor adventures, vast heritage experiences, and small town charm. There is also a growing number of unique ag-related experiences in our Green Garden County. Our data shows a steady increase in visitors, and tax revenue generated has seen a 50% increase over the past 4 years, all due to your continued support. So we thank you again. I'll now pass this along to Sandy in Cecil County.
Hello, great to be with you. Thanks, Tara. Our economic impact study reports that Cecil County visitors generated $242 million in expenditures, $33 million in state and local taxes, and supported over 2,200 jobs. We're also thrilled to be the home of Maryland 5-Star at Fair Hill and Great Wolf Lodge. We truly know that your support has been a big part of our success, so we thank you all. Next up is Holly Gilpin, Director of Tourism for Dorchester County.
Good morning from the heart of the Chesapeake in Dorchester County. My name is Holly Gilpin and I'm the Director of Tourism for Dorchester County. Today I'm going to tell you a little bit about an event that we host is Ironman Maryland. It is one of our biggest events here that we hold in Dorchester County, and it brings about $12.26 million in impact surveys that we give to the county and back to the state of Maryland. Maryland Ironman singly brings out $7 million, and Ironman Eagleman gives $4.5 million. Ironman also welcomes 11,520 visitors to the Eastern Shore. It is 3,791 competitors and almost 8,000 guests come to this area to see the shore and experience Ironman. They also visit other areas on the shore on our sister county, so we really welcome you to come and see Ironman. And now I would like to introduce my sister county, which is Kent County, and Shallon Bolin and Jamie Williams.
Good morning. I'm Shallon Bolden, the Tourism Manager for Kent County. Kent County sees around 225,000 visitors annually. Many of these people are drawn in by the annual events that are held in Kent County all throughout the year. Some of these events include the Chestertown Tea Party Festival in May, Legacy Day and Pirates and Winches Weekend in August, Downrigging Weekend in October, and a Dickens of a Christmas Weekend in December. I would like to now introduce April Plummer from Queen Anne's County.
Good morning. I'm April Plummer, the Marketing Specialist and DMO for Queen Anne's County. Thank you for always supporting the tourism industry. We host large events such as the Bay Bridge Run, the Bay Bridge Boat Show, and the Waterman's Crab Basket Tree Lighting. In 2022, visitors spent $168 million in Queen Anne's County, which was a 7% growth from the prior year. We've seen a growth in our hotel tax with the addition of 120 rooms at the Hyatt Place, and we have another new proposed hotel. Thank you for your time. Next, you'll hear from Cassandra Van Hooser from Talbot.
Good morning again. And I will say that here in Talbot County, we're shining a light on the history and culture of the Chesapeake Bay at the Chesapeake Bay Maritime Museum, which opened its new visitor center in December, and along with our many other cultural institutions, restaurants, and hotels. The industry employs more than 2,000 people in Talbot County and generates $225 million in revenue and $66.1 million in state and local taxes. We have many events here throughout the year: Waterfowl Festival, Sea Glass Festival, etc. So we're on go all the time here in Talbot County. Now I'll pass the baton to Justin Pelosi in Wycomico County.
Good morning. I'm Justin Pelosi, the Tourism Manager and Designated DMO for Wycomico County. Thank you very much for your support of our tourism efforts. Here in Wycomico County, we host over 50 national and regional sporting events annually. With your support, we've been able to draw over 864,000 visitors here to Wycomico County, and those visitors have spent $240 million supporting over 2,100 direct jobs and generating state and local tax revenue of $29.4 million. Thank you. I'd now like to pass it off to Melanie Purcell from Worcester County.
Good morning, Mr. Chair, Eastern Shore Delegation. Thank you so much. Greetings from Maryland's coast in Worcester County. My name is Melanie Purcell. I'm the Director of Tourism and Economic Development. Here on Maryland's coast, we are the only place in Maryland where the ocean meets the land. And of course, with our new rebranding a few years ago, it's been extremely effective in attracting visitors from all over the Mid-Atlantic and beyond. We create year-round visitor experiences, not only for those that visit Ocean City, nature and adventure lovers, culture and history enthusiasts, shoppers and foodies, and more. We're really in a perfect position to a number of drive-to markets such as Philadelphia, Washington, D.C., and Baltimore. We've also started to create some excellent signature events in addition to what Ocean City offers, such as our Maryland Coast Bike Festival in May, the Worcester County Fair, which our county is now going to be running, as well as Harbor Day at the Docks in October. We've seen about 142% of 2019 levels when it comes to visitor visitation. And it's just extreme that, we're seeing these numbers, 2.5 billion in visitor spending, about 15,000 visitor supported jobs, and 256 million in state and local taxes. In addition, our two really highlights in Worcester County, Aztec Island State Park and National Seashore, as well as Pocomoke State Park and the Pocomoke River, seeing about $116 million to our local economy just from those parks alone. So thank you so much, and I'd like to turn it over to Tom Perlazzo with Ocean City.
Good morning from beautiful Ocean City. I'm Tom Perlazzo. I'm the Director of Tourism and Business Development. I wanted to thank you for your continued support and time today and throughout the state as well. Our strategic efforts this year include being more of a year-round destination through many efforts. Obviously the support with the Ocean City Convention Center, some large all-scale season events such as Ocean's Calling, help drive economics for both Ocean City and the state of Maryland. Our industry represents about 13,000 jobs in hospitality. In 22, we had $2.2 billion in annual visitor spending, and we generated over $400 million in taxes for the state. With that, I'm going to flip this back.
All right, thank you so much. Oh, there's Clint. Sorry. Go ahead, Clint with us.
Good morning, everyone. Thanks again. This is Clint Sterling from Somerset County Recreation Parks and Tourism, the director. And here in Somerset, we like to think that we are the home to some of the quintessential Chesapeake Bay legacy events, such as the Deal Island Skipjack races, the National Hard Crab Derby, and one that you all certainly familiar with and come to is the J. Miller Taw's Crab and Clam Bake. And we're growing. These events are growing. We're adding new events each year with Chrisfield Sunset Bluegrass Festival, as well as Jazz Festival in September. We really think that these events help us shine a light on our county and what we love down here. Just a thought, we know that people will come. We had over 15,000 visitors for a 3-day event, Inflatable Duck, in the summer. So we know that folks will come, and when they come, they spend money and they help to support our existing businesses and really lay the seed to develop some new businesses and opportunities in Somerset County. So again, we thank you for your support, and I will throw it back to the star of the show, Cassandra.
Hey, we're all stars here. I mean, listen, are you not proud to live on the Eastern Shore of Maryland after seeing all of that? I mean, it's an amazing place. These are amazing people doing amazing things. And I just am so proud to work with them and to work with all of you. To quote one of my colleagues, every county is important to the state of Maryland. And I will add that every DMO is important to the Eastern Shore. The tourism industry is vitally important here. When you look at the numbers collectively, and we put them together for you here, for the entire Eastern Shore, combining all 9 counties, you can see the tourism industry here is a powerhouse. And that's why your support is so critical. The Eastern Shore alone draws 7.9 million visitors annually, roughly half of whom spend the night. During their visits, they spend $3.8 billion, supporting more than 20,000 direct jobs and generating more than $441 million in state and local taxes. Yes, we are helping pay for the state's priorities. We thought it might be helpful to show you a quick list of our partners and potential sources of state funding. These are names you may see come across your desk, and these organizations are essential to helping us move our tourism efforts along. So we respectfully ask that you consider supporting the organizations listed on the screen. Specifically, I'd like to point out the Maryland Office of Tourism Development and the Maryland Tourism Development Board, which has a $2.5 million grant program that we rely on to advertise our local jurisdictions and attractions to visitors. So one more time, thank you again for your time. Thank you for your support of the Eastern Shore's tourism industry and our destination marketing organizations. We love working with you. We are sincerely grateful. We're all available to you to help with any information you need. We'll take some questions, Mr. Chairman, if we have time.
We have time, and you are, Cassandra, and everyone, all stars, and we are indeed proud, without a doubt. Delegate Hutchinson.
Thank you, Mr. Chair. Cassandra, that was a great presentation by everybody, and congratulations on.
Tom, you muted yourself.
Sorry about that. So that was a great presentation, Cassandra, and everybody else that participated. It excites me to see what we have on the shore tourism-wise. Cassandra, great job on the Fire and Ice last weekend as well. And Holly, thanks for always pointing out the incredible economic driver that Ironman does to the entire Eastern Shore. And we can't do those races without volunteers. So if anybody ever wants to volunteer, come on down. I'm working hard to see whether I can get Governor Moore to come down to shoot the cannon off for the start of our 10th year of having Ironman Maryland in Dorchester County. My question, Cassandra, I keep seeing there's a task force or a group that both from the Western Shore counties and Eastern Shore counties about the feasibility of a passenger ferry coming back. Are any of you involved in that? Do you have anything to share on the viability or where that stands?
Yes, sir. Thank you for that question. I'm going to turn that question to Clint Sterling. There are 5 counties that are part of that consortium, initial consortium, and Clint is one of them. So Clint, you want to take that question?
Sure, thank you. Yeah, so your information is correct. We're about 2/3 of the way through our study, and we are examining, the feasibility for a fast passenger ferry to operate not only in the ports that are in the consortium counties, which is Anne Arundel, Queen Anne's, St. Mary's, Calvert, and Somerset, but in points beyond and other locations on the Eastern Shore as well. At this point, we have a concept and we have an idea. We don't really have anything set completely in stone, but the gist of the whole thing is to be able to drive development, economic development with a tourism model in some of these rural areas and these ports that were there to drive overnight stays and to use the Chesapeake Bay as a connector, instead of a barrier, and to use this great resource that we have. The study should be completed late May and into June. At that point, we'll know what we're really talking about more specifically, and and then we want to bring a lot of folks to the table to see what the actual next step is. The study is gonna drive that. So,
well, great. I look forward to seeing the results of that.
Absolutely. Thank you for your interest.
Delegate Hartman.
Thank you, Mr. Chair. And I just want to thank everybody for the presentation today. Tom, I was a little disappointed in your attire. I thought we'd see the famous sport coat with the Ocean City logo on it. But outside of that, I just want to say thanks to everybody. I was newly put on the Maryland Tourism Development Board, so excited about learning more about how that works and absolutely making sure that we protect the funding that's there. It's not much to start with. So thanks again.
Hey, Delegate Hartman, I wanted to just give you a heads up. I do have my socks on today.
Okay, I need a pair. I think they're under $20.
in.
You can send a pair down, okay?
You got it.
Tom, where do you buy those? You got those in Ocean City somewhere, do you?
We do. We're going to have them online, but we've created an Ocean City store as well. But yeah, I'll make sure everybody has socks.
I think Sensations in Ocean City will be selling those soon.
They might.
I'm pretty sure I've got a picture with Delegate Hartman wearing that jacket. I'll probably have to show it to the group.
Yes, you should. It was a great move on his part. He looked really good. We appreciated that.
Absolutely. Okay, members, I don't see any other questions. Cassandra and everyone, thank you for the presentation. We appreciate the collective way you're going about things for the benefit of the Eastern Shore. It's very important, and we do love you guys. Keep up the good work.
Thank you so much.
All right, next up, we have the Eastern Shore Behavioral Health Coalition. Good morning.
Good morning, everyone. I just wanted to double check if you would like us to share screen. We did provide a handout for you all this morning. What is your preference?
It's however you'd like to do it. If you want to share a screen, you can do that. But we did share and distribute the information if it's easier just to work through it without this screen share. So your call. Okay.
Well, maybe we'll try to move through it without the screen share so we can just see all of you, if that's okay. So good morning and thank you for having us. My name is Katie Dilley and I'm the Executive Director at Mid-Shore Behavioral Health. And I am joined this morning by a very engaged and committed group of our Eastern Shore Behavioral Health Coalition members. I think for several of you, you may know that we've been gathering and presenting to you all for probably about the last 11 or 12 years. We are a group represented by several different entities. We have representations from our local behavioral health authorities here today, some advocacy groups here in the state. We have health officer representation, the Office of the Public Defender, behavioral health provider leadership, as well as a handful of just very passionate and engaged community members. So we really appreciate the support of this group. You've been so receptive over the last several years with receiving us and supporting many of our advocacy efforts. And I think we definitely have you to thank for several initiatives that we've been able to push through and are continuing to work on here on the Eastern Shore to address behavioral health needs of our community members. We have several items to move through quickly, so I will jump right in. But the first thing we did want to bring to your attention this morning, just collectively as a group, we discussed this, that we think it's important that you're just aware of some of the developments at the state level with some systems changes in our leadership. I'm not sure how many of you are aware or follow that closely, but there has been some new leadership that we welcomed at the Behavioral Health Administration with our new deputy director in August of 2023. And we've been working very closely with her. Her name is Alyssa Lord. And her vision and restructuring and realignment of the administration is moving in a direction that will move along the continuum of care, mirroring how folks move in and out of the system here in the state of Maryland. But recently, we did have some transition of some top leadership that we have worked with for several years. We have lost, just within the last week and a half, the leadership of the primary behavioral health early intervention department, our treatment and recovery department, the operations division of the administration, as well as the medical director at the Behavioral Health Administration. And as I mentioned, many of these team members were long-standing, experienced, and dedicated employees that had a lot of infrastructure knowledge and historical contributions to how we've shaped our behavioral health system in the state. So we're really hoping that we can continue to have a productive and engaged development of our system and a vision from the department as we all are sort of navigating this transition and restructuring. But we collectively agreed that it was really important that you are just aware of some of the systems changes that we're working in. Or whatever. So with that, I will hand it over to Tina Brown and Mike Trader, or actually, excuse me, Bill Webb and Carla Thorpe. They're going to give us an update on the AF Whitsitt Center Stabilization Center planning. Thank you.
Good morning. Thank you for allowing us to present today. I will be as brief as possible. In FY24, the governor allocated $4 million to assess the status of the Upper Shore Community Mental Health Center. The assessment is underway. We are hopeful that we can get contracts in place by the end of the fiscal year for a replacement heating and cooling system. That's the current capital projects that are underway. We have also submitted a plan. Midshore Behavioral Health and the Kent County Health Department submitted a plan to the Behavioral Health Administration and the Maryland Department of Health for a crisis stabilization center on the grounds of Upper Shore, and that is currently being considered. That stabilization center is going to be targeted at child and adolescent services that are desperately needed on the shore and elsewhere in the state. We're optimistic that the need will significantly alleviate emergency department backlogs and difficult treatment options for kids and adolescents in that situation. Additionally, we have also our partners, our local partners, are in the process of exploring federal funding for renovation activities at the Upper Shore Community Mental Health Center. That is one and the same with the AF Whitsitt Center. They are exploring federal grant dollars to help us with the maintenance. And as we move forward, we're going to need additional funding than the $4 million that has been allocated, to keep this going. So please keep that in mind as you are considering all of the priorities that you have. And with that, I will turn it over. Thank you.
Thank you, Bill.
Thank you, Bill. Next up, we have Tina Brown Director of Eastern Shore Crisis Response, and Mike Trader, who is the Director of Planning and Quality and Core Services at the Worcester County Health Department, to discuss crisis planning, specifically around regulating the mobile crisis teams here in the state.
Good morning. So I'm Tina Brown. I am the Director of Eastern Shore Crisis Response. We currently serve 8 of the 9 counties on the shore. And we provide the services that we do provide for our community and our families now are all grant funded. So Maryland is moving to a fee-for-service model. And this will be devastating to our clients on the shore and our program on the shore, partly because we don't have a large enough population to support those types of service, a fee-for-service system. But we also have also some other concerns. The new regulations put an additional burden on crisis providers for staffing, because we're going to have licensed staff and peers, 2-people teams that go out on a regular basis, which we do now. We have 2-person teams, but we also include people that have graduated and have their master's degrees, but they don't have a license yet. We also have some bachelor degree folks that are employed with us and do a really good job out in the community. We won't be able to employ them any longer, or we won't be able to bill for them. Let's put it that way. We won't be able to bill for those folks. So it's going to create additional problems with us for staff, and we already struggle. Probably only about 30% of my teams that we have on the shore, our 4 main mobile crisis teams, are even going to qualify to bill. So we're going to have to try and find additional staff. And as everyone knows, it is really hard to find social workers on the shore. And what we continue to do now is we all are taking the same, or after the same people, and they move around. So that's going to be a real problem. But I wanted to give you an idea of how many people we would have to see under this new system if it's only fee for service. We would have to see, and this is to replace our grants that we have right now, we would have to see 10,515 cases every year and be able to bill at least 1 hour for those folks. That is 3 times the number of what we saw last year. It's also 59% of the population up in Kent County. So that's a lot of people, and we don't have the capacity to see that many people with the current teams we have. One of the other concerns is currently we do provide services 24/7. Our overnight we have 3 overnight folks that serve the shore. They go out with law enforcement between the hours of 12 a.m. and 8 a.m. Under these new regulations, we're going to have 2 staff people go out because, again, utilizing law enforcement we will not be able to bill for those services. And just for that, in FY23, from the hours of 12 a.m. to 8 a.m. for 8 counties, we had 22 cases. So, and this is where our law enforcement partners really help us out a lot with this when we go out with them. But we'll have to be changing our model for that. So we know crisis services reduce hospitalizations and reduce interactions with the criminal justice system. We have a mobile response stabilization service, which works with families and children for like 8 weeks. And it has been an overwhelming success. We actually kicked that program off in Kent and Queen Anne's County first. We have already helped several hundred families, but under this new model, those services will be cut and we'll only be able to work with families for 2 weeks. And that's really not enough to help these families and build some resiliency. So they stop using the emergency room. So fee for service will require additional insurance authorizations for follow-ups. We know follow-up visits keep people out of the hospital. They also help reduce the interactions with law enforcement. So we're also concerned that because we're going to have all these visits authorized, we're not going to be able to do the same number of visits now. Under our current system, we visit the person, go out and offer services, connect them to services for as long as they need. So that's going to be a big change. So, and we're not opposed to fee for service, but we will need additional support in order to continue to offer the services that we have. And if we don't have that support, then I think what we're going to see people back in the emergency rooms, more interactions with the criminal justice system. And that is not going to be a good thing for our consumers. And I think Mike Trader from Worcester County would like to say a few words because their model is different from ours. They have a co-responder model in Worcester County.
Thank you, Tina. And that's absolutely right. So here in Worcester County, our program, just like Tina's, is entirely grant funded. The program that we have here in Worcester has been in place for 25 years. It is a co-responder model that puts licensed mental health professionals going out with law enforcement. That has been a wonderful partnership. Our law enforcement officers are actually really disappointed in the change that's coming and concerned both about the safety for our staff who are going to be going out, as well as wanting to make sure that they're not losing a resource because it's been a huge resource for our law enforcement partners. We also do a lot of work. We get a lot of phone calls from Atlantic General Hospital. Under this fee for service model, we would not be able to bill for services in the hospital, but they call us very frequently to go in and assess individuals for safety who are there because that hospital does not have psychiatric services available. Through our model, we have a 77% admission rate. What does that mean? Our primary role is to keep people out of the emergency department. So that means 77% of the folks who go to the emergency department get admitted for inpatient services. That is compared to when law enforcement does an emergency petition and sends someone to the hospital, there's a 31% admission rate. So the importance of really kind of doing a good, strong assessment in the community is super important. And we're just concerned we don't want to lose quality with this through trying to move into a fee for service model. So that's one of our concerns. And like Tina said, I think the other and probably one of our biggest concerns is moving to a two-person model. Staffing becomes an issue. Staffing a 24/7 program is hard enough. Staffing a 24/7 program on a two-person model is doubly hard. And then when you have to try to look at productivity, you're talking around crisis type services. You don't really want to be talking productivity and fee for service standards. You really want to be talking about quality of service. And so, we just want to be mindful that the focus on quality remains paramount. And also, like Tina said, here on the shore, the number of calls that we're going to get, we just don't think is going to make it. So the ability for our crisis teams to survive in this new model is certainly something we're concerned about. And I'll go ahead and allow things to move along because I know we've got other folks who are going to be speaking.
Thank you both. And we will be quick moving through the last couple of topics. I want to invite Lori Doyle from the Community Behavioral Health Association to touch on the Senate Bill 212, House Bill 1048. Lori?
Thank you, Katie. Good morning, Mr. Chairman and members of the Eastern Shore Delegation. It's good to be here with you. Lori Doyle with the Community Behavioral Health Association in Maryland. We represent 89 member organizations that provide community mental health and substance use disorder treatment and services, many of which operate on the Eastern Shore. In interest of time, I want to talk about Senate Bill 212 and the one provision that gives us a little heartburn, and that is a provision that requires the newly created Behavioral Health Treatment and Access Commission, which you all created last year in legislation, to make recommendations about the behavioral health carve-out. This is a very important matter for behavioral health stakeholders and for the almost 300,000 Marylanders who receive services in the public system. Just a brief background. In 1996, legislation that created Health Choice, our Medicaid managed care program, carved out mental health. Substance use disorder treatment was carved into the MCOs. The reason mental health was carved out was fear that the scarce resources would be dedicated to other purposes than mental health, which is what often happens in the commercial sector. So that stayed the same until about 2013. There was a 3-year look at the carve out. All stakeholders were invited, MCOs, family members, consumers, and after a 3-year process, the decision was made not only to keep the mental health carve out, but to carve out substance use disorder services because of the really dismal results the state was seeing with the MCOs. So again, this went on and we're still in the carve-out situation. 2019, a bill was introduced to end the carve-out, and that bill faced such stiff opposition in HGO that it was withdrawn in HGO, and it was actually withdrawn in the Senate before it was ever heard. So this is a very contentious issue. We asked for a couple amendments to the bill, and I want to give a shout out to Senator Hershey, who did a great job articulating the background and support for these amendments. The first one would move the timeline for the report back from January 1 of 25 to July 1 of 25. And that's because if this bill passes, it would only give 6 months to work on a very complicated issue. We think at least a year is appropriate. That amendment did make it onto the bill as it passed out of the Senate Finance Committee and third reader just the other day. The other was uncodified language, urging the department to go for a new integrated care model that the feds just came out with. 8 states will be chosen, and it will provide federal technical support and financial support to move toward greater integration of somatic and behavioral health care. And that uncodified language is on the bill as it passed out. So all of this to say that you're probably going to be hearing about this issue as it moves through. We think we can move toward greater integration without turning the money over to managed care organizations that have not necessarily shown themselves to be terribly friendly toward behavioral health. So just wanted to give you that heads up, and I thank you for your time.
Thank you, Lori. I'm going to ask that Beth Ann Dorman, the CEO of For All Seasons, and Jessica Toole, the Director of Behavioral Health for Caroline County and Local Addictions Authority. They're going to do a brief presentation on student telehealth.
Hi. Like I said, I think everybody said we'll be quick, but what this bill does is it mandates schools to allow all students access to telehealth services, and it mandates a space, etc. While it sounds really great on paper, these are the concerns that we have, specifically as a director of a behavioral health program that has school-based programs. One of the biggest concerns I have is that there'll be no connection between the outside treatment provider and the school. If the student sees an outside provider and is in active crisis after the session, there is going to be no one there to support that child. The advocates for the bill speak of the credentialed therapists doing these telehealth sessions, but there's nothing in the bill that speaks to the kind of providers the students will be seeing, and who knows about the qualifications, etc. There's also no way to ensure background checks for any of these providers. Anyone who sees a student in a school setting it is a mandatory requirement to have a background check. With various providers coming in and out of the school, that would be almost impossible for the school system to do. And when we are in schools, any community-based providers in a school, it is with a memorandum of understanding, and this would spell out all of the steps of the process, the referral, scheduling, and the collaboration between the provider and school personnel. None of this would be able to be done with a drop-in telehealth provider. And I'll pass it on to Beth Ann.
Thanks so much. It's great to be with you all. Thanks for lending us some time this morning. The other side of this, Jessica talks about the students receiving services, but the other part of this is that we work really collaboratively with the schools as school-based providers to make sure that there is a space, that it's trauma-informed, that we are able to carve out time in the school day for children to be pulled from classes. When you open up a bill such as this and a presence of multiple providers where there aren't relationships already established within the school systems, we aren't sure that children will even have a confidential space to be able to do therapy. The other part of it is we know that all of our providers in the community have more need than there are actual social workers and professional counselors. We also know our school systems do not have enough teachers. They don't have enough paraprofessionals. And so you're now asking the school system to do more with less. You're asking providers to come in and take care of situations on a screen and not have, as Jessica mentioned, the provisions in place where if a child does end end up in crisis, there's not that follow through. And so while we are not in support of the bill, what we are in support of is the Maryland State Department of Education and the Department of Health working further to really solve some of these issues. We want children to be able to receive mental health services in whatever capacity we can make it work. But this bill, as it's written, has so many loopholes that not only is it a danger to the family and the children, but it's also a danger to those of us who have worked so hard in our communities to establish strong relationships with the schools, because it can really be damaging if we're doing it one way, another entity does it another. And when all is said and done, we know that without structure in a program like this, it will fall to the wayside. And so it can really be damaging in the long run for mental health services in the school. So thanks so much for giving us time today.
And thank you. I am going to just briefly acknowledge the relationship and the support we have with Delegate Hutchinson around Senate Bill 453. I'm not going to go into too much detail because of the interest of time, and I would like our last presenter to have a moment with you all before we close out. I just want to say we have been communicating closely with Delegate Hutchinson. I know Michelle Hardy and myself are resources to have any questions answered around the impact of this assisted outpatient treatment program bill. There have been some recent developments that I know Delegate Hutchinson is very closely aware of. So I just want to thank you all for leaning into this group for questions of how this bill potentially will impact local jurisdictions. Alan King, who is the Behavioral Health Response Team Lead for the Shore Regional Health System, which is a large provider here of behavioral health emergency services, obviously on the Eastern Shore, did want to just bring special attention to the fact that this bill would have a lot of impact if individuals were required to have this process move through in their nearest emergency department, because the emergency departments have the onus of responsibility with kind of kicking off, identifying when individuals may have emergency behavioral health treatment needs in the community identified. So just want to encourage continued communication from the delegation to this group as this bill moves through. And the last person who's going to be presenting today is Adrienne Bridenstine, just expressing her support around the 988 trust fund fee, and then we will close out. So thank you.
Thanks, Katie. Good morning, everybody. I will be brief. As Katie said, I'm Adrienne Bridenstine. I'm with Behavioral Health System Baltimore, and we lead the Fund Maryland 988 campaign, which is a statewide campaign of over 80 organizations that support strengthening and expanding crisis services for behavioral health across the state. The 988 telecom fee, as Katie mentioned, is one of our top priorities for the 2024 session. This bill would establish a nominal 25-cent per month fee on cell phone bills, which is the same way that we currently fund 911 in our state, except at a much lower rate is what we're proposing. This funding is really important because, as you heard from people earlier today, our crisis services are moving to the fee-for-service system, and that is creating challenges on the Eastern Shore. This funding will provide grant funding for crisis services for 988, but also for those mobile crisis team services. And we know that grant funding will always be needed for 988, and our 988 call centers continue to see an increase in call volume, but will also always be needed for mobile crisis team services. So this funding will help, it will go into the 988 trust fund fee or trust fund. It will generate $15 to $20 million annually, and it can be used to support Maryland's network of 988 helplines and crisis services. It's very important, crisis services. It's very important because, as you know, we have a fiscal cliff coming for 988. There is no plan in our state to fund 988 after FY25. So this is the year to do it. So we urge that you support this legislation when it does come for a vote. Thank you very much. I'll turn it back to you, Katie.
Thank you. And I know we've gone over a little time and there's some hands up. This happens every year. We apologize and thank you for your grace. And we can take any questions if there's an opportunity.
Well, we appreciate you and you have all the time in the world. We every year appreciate the coalition and your critical care and behavioral health care, crisis care. It's one of our top issues that we care about, and we appreciate your presentation. Delegate Jacobs.
Thank you. First of all, Katie, I want to thank you for your presentation this morning and all those who made their presentations. But I wanted to speak to William Webb briefly. Last week, we had the DGS secretary do a presentation to the Eastern Shore delegation. I specifically asked about the status of the Upper Shore facility. And so I wanted to read his response. An architect and engineering firm has been hired to provide design services for renovating the facility. The firm is expected to provide recommendations along with a cost estimate for renovating the facility within the next 2 weeks. DGS will work with MDH to determine the best path forward to accomplish the mission of renovating the facility using the budgeted funds as expeditiously as possible. So there, you should get your words in the next couple of weeks. And if you don't, please let us know.
Thank you. Will do.
Okay, Delegate Hutchinson.
Thank you, Chair. I just want to touch on the bill that Katie was referring to so that all of our county leaders know and understand the recent development. When I came to Annapolis, I was told that we have the best chance to make an influence on legislation in our subcommittees, and I think that played out true this past week, actually this morning. I won't get into the details of House Bill 576 about the assistant outpatient treatment programs, but in a nutshell, this is a bill that came to my committee last year. Somewhat of a controversial bill, but viewed as a good tool and toolbox for serious mental health issues. Last year, the bill was only to be for large jurisdictions and a pilot. When I arrived in Annapolis this year, I found out that Governor Moore found out about the concept, loved it, and it became one of his bills, and it was sponsored by the Speaker in the House, and it became mandated that every county had to implement this program, which significantly caught my attention for all of our Eastern Shore counties. So it came through my subcommittee and working with Delegate Riley as well from Cecil County. We kept pressing the issue about, you can tell me it's funded this year, but how about in the out years? What's going to happen? And happy to report that I got a call from the Department of Health last night, and I got an amendment sent to me this morning that changes it from a shall to a may. So it will allow our counties to opt out if they view that that's the direction they want to go. It'll be presented in my voting session today, and I expect that it'll be fully accepted by my committee, and the bill will move forward. It's a good concept, but I didn't like the fact that it was going to mandate all of our counties to have to implement the program. Thank you.
Okay, good work, Delegate Hutchinson, on that. I'm not seeing any further hands. I think I'm sorry. Okay, Delegate Sample Hughes.
Good morning. Thank you, Mr. Chair. You're having issues with my camera, but nonetheless, thank you all for the presentations today. But I just wanted to ask a process question of Beth Dorman with regards to the telehealth. So if a telehealth provider provides those services to the student, how are they being paid?
You can bill for a telehealth session, no different than you can bill for an in-person session. It's just a different billing code.
Correct. So I guess where I'm going with that is there any, or could there be a stipulation through the Department of Health requiring them to have background checks for any participation that they do with a student?
I think that's sure, there could be that requirement. I think that's a small piece of the larger issue that we see with, getting the background check is one thing, but scheduling follow-up appointments, making sure that the children are seen in a trauma-informed care capacity, making sure that there's staffing and that there is buy-in from the school system to be able to ensure that parents are available, that the child can be pulled out of the classroom in time. So I think yes to your original question, but that's a small portion of the larger picture that we're looking at.
Oh, yeah, I agree with you. I guess what we've had to do over the years and being a legislator is that we have to take little small bites at the apple. If there's one piece of it that we can clean up and get some buy-in from those who are in favor of it or against it, then that's just how we have to do times, and then we take on the next 2/3 of the issue, and then it becomes a perfect issue, a perfect matter for our constituents. So I was just asking for process and clarity.
Yep.
So thank you again. Thank you, Mr.
Yes,
Chair.
absolutely.
Okay, seeing no more further questions or hands, Katie, thank you very much and your team for your presentation today.
Oh, you're welcome. And just to draw attention to the handout on the last page, we did try to list out some bills that we're supporting, following, and one that we do oppose, just as a reference guide for you all as you move through session. And please don't hesitate to reach out to our group. We're happy to come back or just take a phone call along the way. So thank you.
Okay, thank you very much. Okay, next up, we have the Eastern Shore Economic Development Directors, and Matt Leonard, we have until like 10:50, so I know we're running a little bit long according to the calendar, but that's not unheard of here, and we've got plenty of time for this presentation and then yours. So good morning, Eastern Shore Economic Development Directors.
Good morning, and thank you so much for taking the time to hear from your Eastern Shore Economic Development team. Thank you, Chairman, and all the Eastern Shore delegation. My name is Heather Tonelli, and I'm the Director of Economic and Tourism Development here in Queen Anne's County, where shore living begins. Can you see our presentation?
Yes.
Okay, great. Having trouble here. All right. So what we had hoped to talk to you about today is to highlight some of the important projects that we as an economic development team throughout the Eastern Shore region are focusing on, as well as some of the rural Maryland funding and our state incentives that play an important role to make sure that our smaller Eastern Shore counties have a level playing field when recruiting businesses and keeping those businesses here within the Eastern Shore. So what you can see here, we shared a META updated presentation that they recently did and put out, where they said every $9 or every dollar spent results in $9.14 worth of economic impact, which is really important. Here in Queen Anne's County, I hoped to showcase our enterprise zone, which is a state incentive offered within different counties throughout the state. And in Queen Anne's County, our enterprise zone is from the Bay Bridge up to where our Queenstown Emergency Center is located. And this incentive provides property tax credits as well as employment tax credits. And that offers us the opportunity to incentivize commercial development as well as redevelopment, which is really important, especially along our growth areas in the 5301 corridor. We were able to get the enterprise zone designation in 2017, and we were been able to see $135 million in capital investment since that time, as well as over 1,000 jobs created. Just recently in 2024, we were able to secure a dog food distribution headquarters at our Mattapique Business Park, and they were able to utilize some of the property tax credits. And another great project that has come aboard in Queen Anne's County related to the enterprise zone was a $6 million investment in a food manufacturer who's now employing like 40 residents within Queen Anne's County and the region. So we were really excited about this opportunity with the enterprise zone, and I know many of our Eastern Shore counties find benefit in this incentive. I'd now like to send it over to Katie Wright with Kent County Economic Development.
Thank you, Heather. Good morning. Kent County emphasizes small business development, entrepreneurship, and growth and support of our existing businesses as crucial elements of economic development. Kent County offers various tax incentives and programs to attract and retain businesses and provides resources, mentorship, and training for businesses and entrepreneurs. Kent County has invested in fiber optic infrastructure to ensure high-speed, reliable, and affordable internet connectivity is available for businesses, which is critical to attract technology-based industries, enhance productivity, and support innovation. The Enterprise Zone program through the Maryland Department of Commerce is the most effective tool utilized by Kent County to encourage capital investment and aid in job creation by providing property and income tax credits. Collaboration with local, regional, state, and federal partners enriches the range of resources available to businesses. Strong partnerships with the Upper Shore Regional Council, the Maryland Department of Commerce, the Rural Maryland Council, and others are instrumental in providing the resources that assist economic development on the Eastern Shore of Maryland. We want to thank our District 36 delegation for the close working relationship on legislation that affects our business community. So thank you all for your time. And next, I want to introduce Bill Sorensen, Director of Economic Development for Cecil County.
Good morning, everyone, and thank you for having me, and thank you for the handoff. Cecil County is certainly on the right trajectory. We are a growth engine in the state, and we've had a lot of exciting announcements over the last year. I think everybody has heard about Great Wolf Lodge, and that got a lot of press last summer when it opened ahead of schedule, and they already are surpassing their projections for the year, and they're probably going to attract 700,000 visitors to the county this year. But I would like to highlight 3 strategic projects that you may not know about or you may not have visited yet, and that are very important to the county, to our future. And these are the 3 projects that I also brought to the attention of the bond raters in New York City when we got our bond rating upped for Cecil County. The first one is Bainbridge Logistics Park. And for those of you who know the story here, Bainbridge was a naval training center that was in disrepair for many years, that has now been converted into a state-of-the-art logistics park and complex. Phase 1's already complete, and we now already have 1.8 million square feet of state-of-the-art building ready to occupy. And it's on a beautiful cliff in Port Deposit. I invite everybody to go visit this incredible complex. And phase 2 will have a total of 500 new additional acres that will be on the market. Also like to highlight the Belvedere Road interchange, something very rare on the East Coast that shows an economic driver for marketing and development, is that we have in Cecil County a new I-95 interchange being developed at Belvedere Road. It will be online next year, one of the few new I-95 exits on the East Coast corridor. And that will support probably one of the greatest growth areas in the county, Principio Park. And Heather, can you flip it over to the next slide? Thank you. And last but not least, I heard earlier today that housing is in short supply in Maryland. And I would like to highlight our Southfields project, which is being managed and developed by Stonewall Properties. This 600-acre project is a transformational real estate project in the county. There will be 350 new single-family homes, a sports tourism facility, which we lack in this part of the East Coast, and 250 acres industrial commercial development available. And there will also be apartments that also are made for seniors, and there will be at least 200 of those. So very exciting for the county. We have great things going on here. And with that, I'm going to hand it off to Bob Zimberoff, Director of Economic Development for Caroline County.
Thank you very much, Bill. Chairman Adams, thank you so much for having us today. Thank you to your staffer, Betsy, for facilitating this. I appreciate it. And thank you to the entire Eastern Shore delegation for your hard work on behalf of truly the best part of the state. Y'all here know that. I am Bob Zimberoff. I bring hellos and greetings from Caroline County, the land of pleasant living. I am basically the brand new economic development director. I have been in this role for a month. And with that, my report, broadband coverage. Thank you very much to the Eastern Shore delegation for expanding broadband in Caroline County, on the Eastern Shore, and throughout the state. As far as I'm concerned, I've been tracking this issue since, as far as I can tell, its genesis, which occurred within the Eastern Shore delegation by establishing what became the Rural Broadband Task Force, legislation that was led by local leadership here, Choptank Electric in particular, and now grant funding that came in 2022, and finally getting cable in the ground and getting broadband expansion in Caroline County in particular. I've only been in this job for a month, and already through networking, talking to people, going to meetings, I have met 5, 6, 7, 8 people who have broadband now and who didn't have broadband just a couple of years ago. Mainly folks from Ridgely and Greensboro area. They are ecstatic to finally have service, truly ecstatic. And I would also say very happy with Choptank Fiber's customer service. Things are going well.
Chop Tank Fiber has plans to wrap up the project that came with that 2022 funding here in Caroline County. Hopefully by the end of the year. It goes without saying that is huge for our county. And I'm very happy for my neighbors who have broadband now. With me taking on this new role, I have been tasked by the commissioners of Caroline County with kind of shifting the focus of this office. We are taking a harder look at supporting our friends who work in agriculture. As you all know, they face a heavy burden of regulation. We are here to support them, perhaps in some ways, fight regulations that come with every session, or at least attempt to come with every session in new legislation. On top of that, we're trying to kind of shift the dynamic of the way we think about folks who work in ag. To refer to a lot of these people as farmers is simply an old, antiquated way of looking at things. A lot of people who work in agriculture in Caroline and on the shore are entrepreneurs, savvy business people, working within codes and regulations and being good neighbors, and especially innovating the industry. Big changes are coming to agriculture as we speak in the entire area, and we want to support that in the Economic Development Office. We're also need to support manufacturing. A lot of people here at this meeting today know very well that there's a fairly heavy presence of manufacturing here in Caroline County, but in a lot of ways it's unknown. We need to support our manufacturers. Like so many industries, they are desperate for help. They are limited by staff, by workforce, and the sheer reality is a lot of our manufacturers workforce and a lot of workforce in Caroline County are folks who live in Delaware but are working in Caroline because the cost of living in Delaware is lower and the pay in Caroline is higher. It's commonsensical. So shifting also the role of this office a bit towards supporting workforce development at large. Also, well, thank you for Rural Maryland Economic Development Funds. The Denton Industrial Park is filling in. The last properties that were for sale are now purchased, and construction will probably begin soon. We are going to be working, the county is working with RMEDF funds to expand the Denton Industrial Park, hoping to break ground to put in infrastructure, a new road, water and sewer, and then eventually subdivide that property to bring more manufacturing and industrial growth to Denton, back behind the sheriff's office. We are on pace to hopefully break ground on that project before the end of this calendar year. It's really exciting. And also workforce development. Blueprint for Maryland Future is the law of the land now. We are trying to shift focus to getting folks right from Caroline County schools, kids, into good jobs and skipping college. We are very fortunate to have very good people working at Caroline County Public Schools, honestly, to kind of shift that dynamic and reduce that stigma, get good Caroline County kids and good Caroline County jobs. Thank you so much for the time. I'll hand it over to Cassandra Van Hooser.
Great, thank you so much, and good morning again, Eastern Shore delegation. We're excited to be here to talk about economic development, and you've seen me before today, but as you can see, some of us bridge that divide between economic development and tourism, because tourism is economic development. But I chose to focus on a single project today, and that's the new Regional Medical Center in Easton. And we're so very grateful for your support for this project. It took all of y'all to make this happen. It was encouraging to witness the entire Eastern Shore delegation work together to help secure funding for this project. There are a couple more hurdles, of course, but we're already beginning to plan the successful launch with our partner, University of Maryland Shore Regional Health. Now, I have listed here that we are the Mid-Shores hub for healthcare. How do I know this? The new healthcare dashboard on the Delmarva Index shows 185 healthcare establishments located in Talbot County. That is in addition to Shore Regional Health. The industry employs 4,000 people almost in this county alone. So there's a lot of great things going on here. There's a $70 million airport revitalization program going on across the street. Mistletoe Hall Commerce Park paid for with EDA funds, but you know, this is the Big Daddy, will be the largest economic development project in the county's history. Again, we say thank you. And I will pass it to Susan Banks from Dorchester County.
Thank you so much, Cassandra. Good morning, everyone. I am going to focus on one project this morning. I'm going to highlight the recent completion of the infrastructure improvements made to Woods Road. Woods Road is located in the industrial and manufacturing corridor of Cambridge. It's in a hub zone, opportunity zone, priority funding area, and enterprise zone. It's also listed on the SEDS. These zones and incentives provide crucial tools that assist us in attracting and retaining businesses. Businesses in and around the corridor employ approximately 900 employees. Capital investment in the corridor in the last couple of years has been roughly 15 million, and we expect another 15 million in the near future. Recent improvements on Woods Road include repaving, drainage improvements, new striping, and culvert replacements. Upgrades have improved safety and access to the businesses, as well as the ambulatory services using the road to access the new freestanding medical facility. Businesses are pleased with the upgrades and said it's helped with everything from truck traffic to attracting new workforce. The upgrades were made possible with funds from the Rural Maryland Council. It was through a RIMPIP grant and the Rural Maryland Economic Development Funds through our partner at the Midshore Regional Council. I want to thank everyone for your economic development support. And at this time, I will pass it to Dave Ryan, Salisbury, Wycomico Economic Development.
Thank you, Susan, and good morning to everyone. One of our signature projects here is the establishment of an aviation maintenance technician school at the Salisbury Ocean City Airport. That's the best way to retain and grow scheduled airline service for our region. And it's the best way to grow the aviation and aeronautics sector, providing good jobs for residents throughout the region. So far, we've renovated the facility, we've entered into leases, we've acquired aircraft, equipment, tooling, props. We do have a program director, which is now employed by EAS, and we've just started our initial pre-checklist for FAA certification. Our hope is to fly through that and open up in the fall of 2024. Thank you, and I'll pass it on to Melanie over in Worcester County.
Thanks, Dave, and thank you again. Good to see you all. Worcester County, here on Maryland's coast, is long renowned as a fantastic vacation destination. But our county, including Ocean City, is an even better place to launch a career, build a business, and plant roots. I'd like to highlight a couple of initiatives and projects we do have going on with the Rural Maryland Economic Development Fund, which has been tremendous for us, everywhere from infrastructure to some planning projects. Our regional trail and greenways master plan is well underway. That is going to open us up to additional funding for connecting our small towns, Ocean City and the unincorporated areas, as well as our parks, including Assateague Island National Seashore and Pocomoke. We're finding that the need for workforce transportation is a huge part of this. So I'm hoping that when we get this project completed, it'll open us up again to additional funding. We're also looking at improving and expanding our Northern Worcester Regional Sewer project. We're looking at the completion of the dredging of the commercial fishing harbor in West Ocean City, which we know is such a dire need, not only the harbor itself, but we've been talking about the inlet for years and years. Our commercial fishing industry is so vital to Worcester County and to the state of Maryland. Also, our connectivity project that we've got going on our main streets. I know Bob talked a lot about the rural broadband, but we're also working on some projects with these funds that will connect our small towns. Simple Fiber is equipped to go under macadam and really be efficient with getting our small businesses in our towns at a higher speed rate, and also to attract additional businesses to our small towns with that high-speed internet. We would also like to highlight the RIMPIF grant funded STAT program that we have, the Skilled Trades, Ag, Tourism, and Technology. We're going into our 4th year of this program, and it's really been a fantastic way for us to show young people how to really find careers in Worcester County. And then finally, I did want to highlight Ocean City, of course, the Roland E. Powell Convention Center and Performing Arts Center, using Maryland Stadium Authority funding, as well as a number of other funds through the town of Ocean City. The Phase 3 expansion has been tremendous, and as you can see, we've listed some of the economic impact figures. And with that, we also do want to support the regional airport as well, as Dave was talking about, to open us up to additional meetings and events in the future. So thank you so much, and I'd like to turn it over to Danny Thompson with Somerset.
Hi, good morning, folks. I want to thank our honorable senators and delegates for allowing us to take the time. All the ED directors that we work with day in, day out, and our tourism folks. A great way to start off the presentation. Our partners are, without our partners, we can't do economic development. And so I want to thank Tri-County Council, Rural Maryland Council, Department of Commerce, DHCD, Jake Day spoke earlier, and also in here in Somerset, the University of Maryland Eastern Shore. I've got 2 slides there. Heather can move them whenever she wants, because I'm not going to stick to the script. I just want to, the previous administration, we were able to get some funding through the Tri-County Council, and it was $3.3 million. We used about a third of that to purchase some properties, about 165 acres of land. And we are in the process now of getting infrastructure in there with fiber and natural gas and broadband. So we want to thank you guys for all your support. And like I say, we couldn't do this. I did want to share one article that was published by the Department of Commerce in January. And I'm just going to read a couple sentences here. It says, when Maryland, the GDP, the state's most populated areas ranked the highest, with Montgomery County ranking first. When looking for trends over the last 3 years, 4 counties on Maryland Eastern Shore demonstrated the most growth: Somerset, Cecil, Wycomico, and Caroline. Together, these jurisdictions grew by more than 30% in 2022, which, if you'll know, those stats were right at the tail end of COVID, and Somerset represented about 15.7%. So you guys, you do it day in and day out. I believe on the Eastern Shore, we don't believe in wasting a dollar. We believe in stretching a dollar. And I think as the presentation started off, a dollar invested will bring back a return of about $9.14. I actually think on the Eastern Shore, it goes a lot more than that. So thank you for your time, and I'll turn it over to the chairman.
Okay, I don't see any questions from the members. I want to thank the economic development directors for their updates and presentation. When we take that with what happened with Eastern Shore DMO representatives, it's true that we've got great leadership up and down the line when it comes to advancing our interest, and thank you for all that you do in that regard. Okay. Next up, we have Cambridge Waterfront Development Incorporated, Matt Leonard. Matt, we have the 15 minutes, so you have all the time we had on the agenda, but unlike the other presenters, the bells will start ringing at around 10:55 thereabouts, and we'll have to have a hard break. So good morning.
Understood. Good morning, and thank you so much, Chairman Adams and members of the Eastern Shore delegation, for this opportunity to make a presentation to you on what is considered one of the most transformational economic development projects in Cambridge, Dorchester, and even the Eastern Shore region. I'm going to share my screen. Can you see that?
Yes.
Great. Okay. So again, I'm Matt Leonard with Cambridge Waterfront Development, and our project is the Cambridge Harbor Project here in Cambridge and Dorchester County. Just a very brief about CWI leadership. We are a nonprofit community economic development entity. Our board is seated by appointment from the city, the county, the state, and we have one appointment of our own. You can see we have 6 of our 7 appointees there. We have one vacancy in the county. The county's working to fill that now. But the great thing about our board is they bring a diverse set of backgrounds and skill sets that we need to move this type of project forward, and we are moving forward quite well. Cambridge Harbor, and this is our mission statement. I've actually highlighted some of the words there I want you all to be aware of, and what we take very seriously as we try to move this project forward to the benefit of the locality and the region. So our mission is to develop Cambridge Harbor to the benefit of the community and then sustainably operate it and maintain it as a great place to live, work, play, and visit. We take all of that very seriously, and we work very closely with our community partners and our public stakeholders to make sure we are meeting all of those goals. For those of you not familiar, the Cambridge Harbor project is about 35 acres situated on the Choptank River and the Cambridge Creek and bounded on the east by Highway 50. So as you come across the Choptank River on Highway 50 into Cambridge and Dorchester County, it's that large piece of land on the right that once housed the Dorchester General Hospital. Currently, that's what it looks like. We have demolished all of the infrastructure, all of the improvements that were on the site when it was purchased 2 years ago. It's kind of a blank canvas at this point. But again, you can see it's great positioning on the Choptank River, the Cambridge Creek, the deep port in Cambridge, the neighborhoods, the visitor center is to the left of the screen. So we have great positioning. This is what we anticipate it's going to look like, plus or minus, as we move forward. It will be a mixed use development. We have a boutique hotel, 104 rooms. It will be branded with an international brand that people will recognize. We are in final negotiations with a hotel developer now. We anticipate making an announcement in the next couple of months. $30 million capital investment, 75 net new jobs for the hotel alone. There'll be mixed use retail and residential, a large 3.5 acre waterfront park open to the public 24/7, a promenade that rings the entire site for bikes and walking and people to enjoy. We'll expand the beach in collaboration with the county, and then our plan is to guard that so it can become one of the only guarded beaches in this part of the world. We expect 250 to 300 housing units of various types, single family, townhomes, condos. We will be managing the right mix of those, but the market will also dictate which ones are going to work best at what times. Regional impacts, we think this is really important. 75% of the developers and builders that showed interest for the project were from the region. You can see the map where I show Cambridge Harbor, and those dots represent where we got letters of interest from. We're working through the 28 to 30 or so responses we received in order to identify the best partners for us. During development, 968 jobs with an average wage of almost $45,000, so $5.4 million of additional income into the region annually during the development of the project. And then the permanent jobs, 269 at 40,000, so over 10 million, almost $11 million of additional income for the citizens here in the region after the project is complete, with $155 million economic impact for the region. So again, very brief oversight view of the project, and happy to take questions.
Okay, Matt, let me see if there's any questions. I'm not seeing any. Matt, let me just ask you a couple questions that I have. I mean, when this is my 10th year in service, I drive across that bridge coming home, and to the right there, I can definitely see the vision that could happen there. And could you give me a timeline? So what's the vision as to how long before that waterfront development is fully realized from your perspective?
So great question. We're operating in kind of a two-phase model. Phase one is all of that land east of the existing public boat ramp, west of the existing public boat ramp along Cambridge Creek. That includes the hotel, which we expect to be developed in the next couple of years. It includes an expansion of an existing boat works out there, which we expect will be expanded in the next couple of years. It includes some improvement to the Richardson Maritime Museum, a great amenity here for the region. That will all be done in the next 3 years or so. And then following that, probably 3 to 5 more years after that. So somewhere through 2032, roughly, all of it should be finally developed.
Mm-hmm. This morning we had the Secretary of DHCD in, and I asked him a question at the end related to funding that comes through these these government agencies, and DHCD is the mechanism to leverage federal and state dollars. So can you give me your thoughts on where you see that today? And if you heard his answer, I think we have some budget difficulties over the next 4 to 5 years, and whether or not they realize themselves as such or not. Just give me your thoughts about how you're viewing partnerships with the state and federal government through way of support and funding.
Partnerships with the state and federal governments are critical. Of the $13 million we've raised so far to help develop the public infrastructure and amenities, about $9 million has come from the state, and about $3 million has come from the federal government, $3.5 million. So very critical for us. It's interesting listening to the governor's incentive initiatives with regard to housing, listening to Secretary Day's take on some of those things. The project, Cambridge Harbor Development, actually ticks a bunch of those boxes, right? 250 to 300 housing units on property that was formerly partially state-owned and actually generated zero tax dollars, and now will generate millions of tax dollars when it's developed. It's in an opportunity zone. It could be used as part of a CDE if we need to. It ticks a lot of boxes, so I think we align really well with the initiatives of the state. I think with whatever form those pieces of legislation finally take, I think we can not only be a region that's not left behind, but really be in the forefront of using those particular types of buckets of money to advance the entire region through housing development and workforce development and various types of economic development.
Mm-hmm. Yeah, I've said often, and I know that Delegate Hutchinson and Senator Mounts and Delegate Sample Hughes and I all agree that Cambridge is center of the Eastern Shore. I sort of call it the heart the Eastern Shore in that respect. Each county has its own, as we heard today, special places in our how we develop and how we grow and how we create jobs and opportunity. But that Cambridge Harbor to the right, that is a transformational opportunity, and it's interesting and encouraging to hear your presentation. So unless you have any other further comments to that point, we literally got the first bell. I'll let you close, and thank you for your time there.
Well, thank you, Mr. Chairman, and thank you all. District 37 delegation is well aware of the project. They stay on top of it. Delegate Hutchinson's office is right across from my office here in Cambridge when he's not doing his expert work in Annapolis, and all of the Eastern Shore delegation. We appreciate everything you do every day for us, and just want to help you keep you apprised of what we're up to. And if you have any questions, please feel free to contact me.
All right, sounds good. Thank you very much.
Thank you.
Federal updates. Alyssa Hastings, I saw you a minute ago.
Thank you, Mr. Chair, and good morning. No updates from our office at this time. Thank you.
Okay, Kim Cradaville, are you with us?
I'm here. No, I would just say Alyssa and I continue our congressionally directed spending meetings, and you all know where to find us.
Okay.
Thank you. Thanks for the great updates today.
Yeah, this was a good agenda. I'm having a hard time with my, it's either Mike Detmer or, no, there's, good morning.
Good morning.
From
How are you?
Congressman Harris's office.
Yeah, how are you? Thank you for having me this morning. Great call. Very glad to get all the information about what's going on in the district. Just a couple of things. Congress is currently out of session, but will return next week to address government funding, which sets to partially expire on March 1st. The congressmen, along with other appropriations leaders, are still in negotiations with the Democrats in the Senate to try and work towards avoiding a continuing resolution, short term or year long, but nothing is certain. A lot of these decisions will end up being made by leadership in both the House and the Senate. There remains a possibility of a year long through September 30th continuing resolution, which would kick in automatic 10% cuts to non-defense spending. This was a contingency plan built into the Fiscal Responsibility Act, which was signed into law last year, but those cuts don't include veterans programs or defense, if you have any constituents that ask about that. So last week, Homeland Security Mayorkas was impeached on the second attempt in the House, and Congressman Harris supported that. The Senate will have to decide what action they will take to address the House impeachment, but it probably is not going to go anywhere realistically. And that is all for federal news. Again, our office is always here for your constituents. Appreciate those who reach out when you have a federal issue. We're happy to help with that.
Okay, I need a motion to adjourn. I think we're all headed over to the house. Have a good evening or a good day, everybody.